Hello, hello. Hi, happy Saturday. It's unusual for us to go live on Saturday, but we're having a special discussion with one of our friends, Jodylynn. And I'm gonna wait for all of you guys to join here. This is gonna be a follow-up discussion that we're gonna have with Jodylynn here today. And we have touched and we had the live before. It was during March, and we were celebrating the female empowerment, and we're talking about the opportunities that now we have to express our beauty and everything else. So it's been quite some time that we haven't been live together, but we're super excited because this time we're tackling in one of the most frequent asked question is, how do I get started with the Lumo? And sometimes people have the Lumo, they're confused, where do I get started? Because it is a multifunctional type of device. So I'm just gonna ask for Jodylynn to be joining here. Hi. Interesting. We have posted before, and we asked for questions. So if you have any questions along the way, we're gonna do a live demo. So it's gonna be super interesting. Hi.
Hi, can you hear me?
Yes, all good, clear.
Okay, I don't think this is working. Okay, that's fine.
You look
I can hear you.
lucky. You look equipped with devices. Yes.
Oh yeah. I'm all ready to get started. It's so nice to see you.
Yeah, me too. I was just making an introduction here, and I'm so happy to have you again. Last time we were discussing about beauty, we were discussing about female empowerment because we were talking during March, and we were I remember I was thanking you for all the work and the support that you share with all of us and the positive attitude, which is super important. So I'm just super excited to have you here again.
Thank you so much, and so am I. I could talk skincare beauty devices all day, so I'm always excited to be on here with you guys. Thank you.
Yeah, and I know if this is a Saturday morning, and I know I don't want to take too much of your time, but this is a special one because usually when we go live, we're talking about different technologies and devices and the things that we can do. But it's the first one we're doing a live treatment with the Lumo. And why we're doing this, because so many people are confused because it has so many modes, and there are ways where you can create your own schedule and adjust to your needs in order to get the results that you're actually looking forward to. So I know you're an expert with the Lumo, so I feel super confident and comfortable with you guiding people on how to actually start with the device, prep your skin. So you can get started if you want. And while we're gonna do the treatment, I'm gonna just kind of ask you some questions on the, like, I remember most of the questions that people usually share, and I have some of the notes here because there are different questions that we can go over while you're actually doing the Lumo session.
Okay, perfect.
Amazing.
All right. I'm excited too. I like to start with the cleaning, the ion mode. With the RF, and I love these little silken wipes. They fit perfectly right on that area, and it's thin enough to be able to absorb, the essence or toner that you're going to use. So, and I like to do this treatment once a month for that deep clean. And I like to use either a hydrating toner or something that is or a green tea, which I have been using, the Isn't Tree Green Tree. So I like to just saturate that.
Yeah, and usually when you press on, when you turn on the device, it's going to start in the radio frequency first mode, but you're starting with the cleansing first, just to kind of prep your skin and get ready. So there's like a pre-programmed sequence where how you can do the treatment, and that will be, and I have the manual here, so whenever we need, we can kind of visualize the process. And that would be like, for the first step, it would start with the radio frequency. However, if you want to go for that deep cleanse and you want to do the treatment before going to the radio frequency, you can do the ion, which is a deep cleansing mode. And this is what Jodylynn is doing here at the moment. And you can create your own kind of routine. If you want to focus on an anti-aging goal, you can do the EMS and the radio frequency and then the cooling. Or if you want to go for a more kind of all-in-one treatment, you start with the cleansing and then you have the product penetration, which we're going to go all over.
Yes. And I think that is one of the reasons why I love this device the most, is because of all of the modalities that you have in this device. And I've said this so many times, and I continue to say it to this day, is that I feel that this is the Cadillac of all beauty devices because of all of those modes, and that also have the flexibility to be able to customize the treatment.
Exactly.
So I like that we're doing this live to talk about that, because if you are new, it can be a bit overwhelming, for sure. So, but I've also done a whole video on how to use it as well. But I think that, you know, answering any questions that we can is going to be really helpful as well. So, but yeah, so if I'm doing that deep clean, I like to do that to prep the skin first.
Yeah. For anyone who isn't aware, the Lumo is a radio frequency based device. So when you turn it on and when you're going over 5 modes, so it has 5 modes and 5 intensity levels. When you turn it on and you're doing the treatments, it is an RF base. So each mode is going to include the radio frequency. So there is no feature of turning the radio frequency off. If anyone, because I remember we had this question before, I want to do just the EMS and I don't want to do the overview, for example, the radio frequency. No, it is a radio frequency based device. So all the other modes are in combination with the radio frequency. So if we're talking about the cleansing, what Jodylynn is doing right now, it is a radio frequency and it has ion at the moment, which is on. And this way you are cleansing while you're also benefiting from the radio frequency.
And I think that in something, and let me know your thoughts on this, but when I'm using like the ENI or the IN mode, I like to actually use it at a level that is between 1 and 3. I don't like to go too high because, again, I'm just kind of like wanting to get the benefits of the cleaning and that ENI. And yes, you want the benefits of the RF, but I like to save the higher modes for the RF and the RF EMS. That's me personally. And I think it's a great way to warm up the skin if you're keeping within that 1 to 3 range. But that's just kind of my what I do. Everyone's skin is going to be different for sure.
For sure. And you kind of have to start with the device first and see how it feels for you. And for example, for some people, the EMS might feel a bit too much. They're just having this on the first or like the lowest level. And when they're doing the radio frequency, because of its design, like you don't feel the heating that much. So it's really comfortable to use it at, let's say, for example, level 3 or level 4. But it also depends on like sensitivity and how much you can tolerate the radio frequency or the EMS. And I see a question here. How long do you do the cleaning mode? So
I just do what it is on here, which is the time. So I think this is a 3-minute treatment.
Exactly.
Yeah.
So
this is a 3-minute treatment. So I just use it when it is done. I stop. So I don't do any additional cleaning.
So it has an auto timer. The device has an auto timer on it. It's going to beep when it ends. So you don't have to think about how much am I spending on this cleansing mode? Am I overdoing this? It's just going to shut off and be on a standby mode. And then you can move to the next mode after it beeps. And how do you prep your skin before it gets started? So you said you do the cleansing mode a few times?
Yeah, so for me, if it is in the morning, then I just like to use a gentle cleanser. I like to use a gentle cleanser, make sure that my face is nice and clean, and then I will use some sort of toner with the cleaning mode. If it's in the evening and I'm wearing makeup and sunscreen, which I usually am, and you always should be wearing sunscreen if you want these devices to work as well, but then I like to do a double cleanse. So I will then use an oil base cleanser as my first cleanse, and then I will go in with a gentle cleanser after. But I like to make sure that, my skin is really clean, even before going into that deep clean mode. So that's how I like to do it.
Yeah, Nice.
Yeah.
And then what is your second mode that you go into?
Well, I like to go in then with the RF mode. What do you think?
Just, yeah, sounds
So
perfect.
I like to go the RF mode and then the ENI mode. And I am kind of curious with your thoughts. That's how I've been doing it. But do you think that the ENI mode should come before the RF mode? I'm just curious to know what your thoughts are as well. I mean, it seems to be working for me, but I'm curious also to know your thoughts.
It is totally based on people's preference, and I'm gonna tell you what I like to do. I like to do the ENI mode after I do the EMS mode and just right before the cooling mode. So like I cleanse, I do the RF, I do the EMS, then I do the product penetration, because then I usually do the Lumo in the evening. So then I have all the products kind of sitting and
See, that's what I was thinking too, because I'm like, I think that would be better. Yeah, I love that.
Yeah,
so that's what we're gonna do
this
today.
is how I love doing that. It feels
Yeah.
more like, okay, everything that I'm putting in is just gonna stay there and it's gonna work on my skin during the night.
Yeah. So, and this is a question that I get a lot too, is do you use a conductive gel? Do you use water-based? And for the RF and the RF EMS. So for the RF and the RF EMS, I actually like to use the conductive gel. And I think your conductive gel is absolutely beautiful, just so you know. It is really lovely. I love the collagen peptides, the hyaluronic acid. It is very hydrating. It's lovely. Something that I like to keep around as well while I'm using this is a big thing of thermal water. So if this tends to get a little bit dry while you're doing it, no fret, spray on water, it's going to reactivate. And then you don't need to continue, you know, and this is going to last a lot longer for you as well. But this is wonderful.
Absolutely.
So it's really light.
Yeah.
And it just feels really good on the skin as well. So we're going to go in with the RF mode, and that's what we're going to do. But I also just want to say that if you have advanced signs of aging and you are really looking to do something at home, I really suggest looking into RF if you have not looked into RF. Like radio frequency is going to be what you need really to help with that sagging skin, and that is what really changed my skin was radio frequency. So I don't get any Botox, fillers, plastic surgery, and I didn't start taking care of my skin religiously until I was 47, and I had a lot of damage, and my skin was really starting to sag. And so, you know, I just really tried I just started diving deep into skincare and was like, oh my gosh, what can we do? And I just thought, well, if you can change your body with cardio, good nutrition, I've talked about this before, and weight training, why can't you do that with a face? And that's where I started just really diving deep. And it wasn't until, and skincare was working wonderful for me, but radio frequency took it to literally the next level. And I just think that is something to just kind of keep in mind if you really are looking to go, you know, the beauty device route, radio frequency, and this has everything that you need with that EMS as well.
Yeah. And yeah, and I remember when I saw one of the videos that you were sharing, the before and after photos, your face seemed younger and like more youthful, I would say, and more radiant after you started doing different treatments and the EMS and the radio frequency. So there is actually science behind this, that you can actually reverse kind of the signs of aging with the technology, because we're producing more collagen and we're stimulating that process of rejuvenation. So what we're doing with the radio frequency is we're heating the skin. So we're creating more collagen, and then this way our skin is going to start to tighten. You're going to see a result with the radio frequency, I would say, after probably the third month that you're into this. You can feel more of the effect with EMS, kind of instant, and you're going to see more of a lift, because that's going to contract the muscles, and this is how we're going to have a more toned look. But with radio frequency and the process of collagen production, it's going to take a longer time to actually see results, which is why we call this a long-term anti-aging goal. So the radio frequency is actually going to give you the benefit. And as you mentioned, one of the questions that you usually get is, what type of conduction gel do you use? We, of course, recommend using the EvenSkyn conduction gel, but actually the Lumo has been designed to be used with water only. If you don't have anything close by, you can spray some water, or you can use aloe vera gel. It could be anything water-based, and it's just going to be working just fine. And it's nice to kind of have some ingredients that are going to give you more benefits while you are also doing the treatment.
I agree. And I like to go, for me personally, I like to go a little bit higher, like at a level 4 or level 5. Now, please note that I'm an avid radio frequency user. And so if you are new, definitely do not start out there. You want to start out at a level 1. But again, I've been using radio frequency and beauty devices for 3 years. So, and I've seen great results. But if I'm at that higher mode, or excuse me, that high level, like a 4 or 5, then for me personally, I like to use a conductive gel. I think that it just gives a really nice, like, protective base between the device and also the skin, because it can get a bit, heated. But again, that's going to depend on you. Everyone is different on, what they feel and what they don't. So I like that kind of a little bit more protective barrier, and I love the ingredients in here as well. Because it really calms and soothes. And I think also what's really important, and a lot of people don't talk about this, is that with radio frequency, you really need to keep the skin hydrated. Because if you're not, it could because it's heat, so it could definitely, your skin could become a bit more dry. So you're definitely going to want to use something that is super hydrating. And so I also find when I'm using the conductive gel, like I don't get that. So it keeps it moist and hydrated.
Yeah, and it is also because it has hyaluronic acid, it has glycerin, which is amazing. It is super great ingredient to have in a conduction gel, because, and it also, like, you can see based on the consistency of the product, it is super nice. Like, it's gonna give a nice shine, and like it doesn't dry up that fast for most of the people.
No, it doesn't.
If your skin is super dry, then probably you're gonna feel it drying a bit more often, but otherwise it just lasts for a long time. And the radio frequency treatment, based on the recommendation and the auto timer that the device has, is going to last for 5 minutes. So if you're doing the face, that's going to be 5 minutes. But we usually get the question, if I want to treat the neck and the décolleté area, we recommend for another 5 more minutes, because like you're focusing 5 minutes on the face, avoiding the eye socket and also avoiding the thyroid area. This is where we don't get close with the radio frequency and the device. So you could have another 5 more minutes and do the neck treatment. So that's going to be like a 10-minute radio frequency with the radio frequency only mode.
Right. Yeah.
And
That's what
I see a question. Again, explain the benefits of radio frequency. What is it doing to your skin? And you have lots of experience with the device, so you can talk more about this.
Yes. So that's such a great question. So it's going to help build collagen. And what it does is it helps to tighten the skin. So radio frequency is wonderful for sagging skin, especially in this area, which is where I and most aging women find the aging process just really starts to go downhill. It's this area right here. You get that sagginess in here, the marionette lines, you get those jowls right here, and that is going to help to tighten that area. Now, something else that I've noticed for me personally, and this hasn't been discussed a lot, is these mid cheek lines. So my biggest problem was this area sagging, as well as I have these cheek lines, if you can see them.
Yeah. Mm-hmm.
So they were a lot deeper, okay, when I first started the beauty devices 3 years ago. And radio frequency has definitely helped to minimize these lines. Please know it's not going to get rid of the lines. That's not what I'm saying. It's not. But when you are lifting and toning that tightening that skin, you can even see like just the littlest tightness is going to lift it, and it's going to make it appear not as deep. And that's what I have noticed.
Yeah.
So, and my sagging jowls, like this whole area is a lot tighter than it was 3 years ago.
Right.
And so that is where you're going to see, I think, the biggest benefits.
Yeah.
For sure.
And we're going to see the kind of the signs of aging usually on this area. As you mentioned, it is also because of the gravity and everything is kind of more pulled, and we're losing skin elasticity. So our skin is just not going to look so tight as we kind of every year we lose at least 1% of collagen production starting from age 25. So every year that percentage is just increasing. So with the sun exposure and with so much gravity pulling our skin down, we're going to see that we lose elasticity, especially around here. And then we kind of start to change the contour of our face. But it also brings me to the question that we usually get about the fat loss. So radiofrequency is also a concern for so many people out there because they hear stories from in-clinic treatments, which are super powerful devices, recommended for a very short time. And I'm just going to answer a question here. How often do you use the device? So we recommend using the Lumo once up to 2 times a week. So when you start in the beginning, you start with once per week, at least, for example, the 2 first weeks. After the first 2 weeks, you can start and increase up to two times a week, depending also on which age group you fall into. So if it's the first time with such device, start low, start slow, and you start increasing until you kind of get used to the device. But if you're doing an in-clinic treatment, that is far less recommended in terms of frequency. So you're going to do once or probably twice treatments throughout the year. But you have had experience for 3 years with radiofrequency devices. How do you feel about fat loss? Because there is so much research, there are so many stories from different people. But did you ever experience something like fat loss? And
No.
Can you tell us why and how did this whole thing happen?
So I've been using radiofrequency, like I said, for 3 years, and I use radiofrequency every single week. The only time that I don't and I take a break off is when I'm doing microneedling sessions. And I'll take a break off for a good week. So really 3 months or 3 weeks out of a month, I'm using radiofrequency, and I've been using it, like I said, for 3 years, and I have not experienced any of that. And like you had indicated, they're not engineered in that way, and they're so different from in-office treatments, where in-office treatments are a lot more powerful. And I think also I've heard stories in that this is the only stories that I've ever heard that this is happening is in clinic treatments, and it's usually with someone that's not that experienced in giving the treatment. So that is something to really be mindful of. And from my understanding, the megahertz on here as well is getting to the dermis layer, and it's not even hitting the fat layer, which is so much deeper in the skin tissue. So you don't have to worry about that at all. I don't, like I said, I've been using it for 3 years. So yeah, and
Exactly.
That's my opinion.
Yeah,
I won't stop using my radio frequency because it is what has been helping this area. So so I'm not giving it up, and I've not seen any of that. And I have a long face. And so that would be, that is definitely something that, to be concerned about. I understand when you hear these stories, especially if you have, like, I have a thinner, long face.
Mhm.
And I have not seen any additional, no, not at
Yeah.
all. And if it
And
did, I wouldn't use it because I definitely don't want that, but that's not
mhm.
the case. So.
And it wouldn't happen with an at-home device that has been designed for at-home use and has radio frequency, and depending on which device you're using. With in-clinic treatments, as you mentioned, it might happen depending on what type of device you're using, and also like who's doing that, depending on the power, depending on your skin. Usually, when I've seen photos from people, what they usually share, it has been what they're seeing the fat loss usually around the cheeks. So, I mean, I have been working with the Lumo for so long, and I have known people that use the device, but not just the Lumo. I know so many other radio frequency devices out there. They do not cause fat loss because that is almost impossible. And it is because the radio frequency, and you can also like see it stated here, the radio frequency, it is at 1 megahertz. And what that means is that it doesn't reach the fat layer. If it goes higher, up to 2 or 3, that is not designed for the face area. That would be something for the body, which would be a very powerful device. So if that is increased, or a device has that potential, it is usually not designed for the face, neck, and décolleté area. So if we're talking between 1 megahertz, depending also on the temperature, depending on the sensors that the device has to detect the temperature, this is how you kind of need to do the research and see if the device is fit for face. So yeah, we have never heard anyone experience anything such as fat loss. And I remember there is a very nice interview done by Zane and Claire, the Honest channel, and their focus, like it's a 30-minute something type of interview. Zane, who's our partner, we have been discussing about the fat loss, and it is a more in detail type of interview where we discuss the Lumo, its specifications, and all of that. So if anyone needs to check that, you can check that on the Honest channel, which is Claire's channel, another friend of ours who we work with. And I see it.
Also, Dr. Dre, who's the dermatologist, she's also done fat loss, and if it, breaking the myth of that on beauty devices, at home to beauty devices and fat loss. And she also indicates there's no evidence that beauty devices cause fat loss at home beauty devices. Exactly. So I think we've got a lot. It just needs to get out there more because, man, the fear is really out there, and I get it, but it's okay. We can let that go. It's not gonna happen.
And it depends if it's the device is bipolar, monopolar, all of those things you need to kind of consider. You're doing the EMS. I see your muscles. Right now. So for anyone who's following the routine right now, you're in the EMS mode, right?
I am. And I love to focus again on when I'm doing the RF EMS, and I really want you to talk about this, but in just a moment, but I love to focus again on this mode is all on my lower face. And I focus also bringing it up to the cheek. And because my face tends to be thinner and I've got that fat pad loss, I like to bring it up like this and like get that cheek area. For me personally, that's what I like to do. And so that's what I like to do. But I also want you to chat about, because I remember when you guys, when I first started this device a couple of years ago, we had a conversation with one of your engineers as well about how that RF EMS, it was important for you guys to see if you could create something that was close to the Morpheus 8, because that was such a big, that's a treatment, that in clinic treatment that a lot of people are doing that see great results, and how you might be able to do something kind of similar but in an at-home device. So I thought that was really interesting, because this is kind of what you have came up with. So for those of you that don't know what the Morpheus 8 is, it is radio frequency with microneedling that you can get done, but it's only in clinic.
Yeah.
And, you know, obviously that's just not something that you can do at home due to safety reasons.
Yeah.
So this combining that RF with that EMS was like, from my understanding, your way of getting as close as you could with an at-home device.
Exactly. Yeah.
And this is one of my favorite treatments. I love the RF with the EMS.
Yeah.
It's
And
amazing.
while you're doing RF EMS, you're also getting the red and blue light therapy, and there's also sonic vibration. So you're also getting like more benefits rather than just like the radio frequency and the EMS. So, and I see a question. I missed what you are spraying on your face, and it is also has to do with the conduction. So we can talk more about this. So is the EvenSkyn thermal?
It's the EvenSkyn thermal water. This is just water. That's it. It's just a high quality water. It's not from your sink. My sink tends to be, I'm in Vegas, my sink tends to be very high salt intake. But so this is just that really clean water. And that's what I like to reactivate the gel with.
Yeah. And so as we were talking about the Morpheus A, so that is a microneedling RF treatment. And there are some microneedling type of devices with small needles that people usually do at home. However, we do not recommend for at home microneedling if you're not that experienced or if you don't have a very strict protocol, because there is a potential of infection, there's a potential of skin damage. So you really need to be doing the research first, being very careful while you do the treatment. Probably it would be best to do this with a professional first to get used to and probably learn how to use the device for if you're doing that at home. And if you're doing a Morpheus treatment, that would be a radio frequency. So while you're doing the microneedling, you're kind of damaging the skin. You're sending signals, okay, there's damage. We need to create more collagen. We need to heal faster so we don't cause more damage to the skin. And then with the radio frequency, what we're doing, we're helping that collagen and the healing process to kind of kickstart and like just make the healing process a bit faster. So if we're doing that treatment, you would need kind of a protocol to give it some time to heal, because that is also what is very important when you're doing a radio frequency treatment. This is why we also recommend that if you're doing the Lumo, you need to give it some space in between sessions. So the healing process happens and your skin is kind of in a calm state. So you can do a red light, for example, therapy, which would be amazing. So we help the skin to kind of heal itself. For us, since we couldn't include something like microneedling, we included something like the EMS, which would be the muscle contraction, and it's a combination of radio frequency and the EMS, and it has phototherapy. So what we're doing here, we're giving that kind of maximum strength to our skin, and it would be the same as a workout session. Yeah. So we're tightening the muscles. We're also doing the radio frequency. We're doing the red light therapy, and we're also having the vibration. So right now, for example, in our skin, you're going to see the muscles twitching, and it would be something the same as lifting weights, where we're giving more strength to our muscles.
Yeah. Yeah. And that two combination with the RF and EMS is brilliant. Just really brilliant. So I love that. Absolutely beautiful. So we're going to go in with the ENI mode now. And I love to use peptides or growth factors, just really hydrating products, because that ENI is that electroporation that's going to help to penetrate the products deeper into the skin. So I don't like to use any type of irritating ingredients like glycolic acid, retinol. You know, they already are formulated to be able to get where they need to go. So and it could be potentially more irritating. So I like to stick with peptides, growth factors. So I'm going to use a growth factor as well as even the ordinary, the buffet. This is wonderful. Copper peptides. Love this. And that's what I'm going to use, and that's usually what I use with that ENI mode. I'm just kind of curious, what do you use?
Yeah. And I see a question here. I have the Venus suit.
Okay.
Can I also use use that every week and how often? Yes, with the Venus, it's instead of radio frequency, it uses thermal heating. So that is safe to be used more than once or twice a week. So in the Venus manual, you can see a schedule here, and you can use it 3 times up to 5 times a week. And you can do this every day, probably take the weekend off, and during the weekend you can do the Lumo treatment, so it depends on your schedule, but it is safe to be used more than once or twice a week. So because it has less power, because we're talking about the sensitive area of our eyes. And yeah, also for the ENI, I love to use something like peptides. And usually I feel like I get enough when I use the conduction gel. So for me, the ENI mode is more like completing the session with a water-based moisturizer or serum. And I also like to use the ordinary buffet, Cooper.
Oh, you?
Buffet. So it is amazing. And I think that is something we would also recommend to other people who would be in the midst of what can I use, what would give me the best benefits. So something like antioxidants would be amazing.
Yes.
I'm just going through to see if there's any questions coming from people. And if anyone has more questions, please feel free to drop them here. We have Jodylynn doing a live treatment, which is super special. We're doing this on a weekend, which is amazing. And how often do you use the Lumo yourself?
I use it once a week.
Once a week.
So yeah, and like I said, I usually use the Ion once a month, and then all the other ones I will use once a week. I'm in maintenance mode, so and I like, you know, I get it done once a week, which I love. So I do the full treatment once a week.
Yeah. And how long did it take you to actually see the results yourself and say, oh, okay, this is something that I have been benefiting from? Because I know, based on the research and your knowledge on radio frequency and the technology, you know you're gonna see results. But when was it when you said, okay, right now I see that it's actually making a difference?
I would say it's definitely 3 months.
3 months.
3 months, you're gonna see results. In 6 months, it's like, holy cow. That's like, that was my experience. And I think that you need to be, you know, make sure that you're taking before and afters. Make sure that you're being consistent. It's so important. And I can't emphasize enough to make sure that you are wearing sunscreen.
No device is going to do the work if you're not wearing sunscreen.
Unless you're not. So you have to wear sunscreen, because that is, you know, the sun is aging us. So make sure that you get your sunscreen on, and I can guarantee you're going to see results. And another area that I've seen wonderful results is in that turkey neck. So if you've got, and like I said, I've talked about this whole area, and we've got those saggy jowls, but we also get that turkey neck right here. And so when you're working on it like this, and you're pushing this up like this, you are going to see a wonderful result in the minimization of that turkey neck.
Yeah.
All of this just gets lifted and tightened, and it's amazing. And I know that there's other people that have used the Lumo that they show before and afters of that area, and it's very impressive.
Yeah, and usually this is where most of the people focus on using the device, because most of our signs of aging kind of appear on this area. And the turkey neck, the jawline, if you're doing the treatment, you need to avoid the thyroid area, but you can definitely use it under here.
Yeah, don't use it here. No.
Yeah,
but right through here.
Muscle tightening, skin tightening, actually, that is just going to give a more lifted effect, both from the radio frequency and the EMS. So we're tightening the skin, but also we're toning the muscles. So it is an amazing kind of treatment, because if you're doing workout, let's say you're on a workout session, you kind of are stimulating the face, or like you're doing some muscle workout, but it's not enough compared to, like, for example, what we're doing if we're exercising. So we have the full body stimulated, but it's not with our skin. So it is really necessary to also like treat this area. And really in the forehead, with the radio frequency, you're going to see that the lines and the wrinkles are going to disappear. Not completely, but they're just going to kind of be a little bit more smooth. But since we do not have that much muscles kind of or thickness in this area, it's really more about this part here where you can focus on. And I think it's also very important to mention that while you do the treatment, and I see like you're focusing here, but also you're doing the treatment upwards. So you can talk more about this, but we recommend upwards and circular motion.
Right.
That is going to help with kind of having that lifted effect.
Right. The lifted look too as well. Mm-hmm.
Yeah.
And I do that on the other treatments. And then when I'm on EMS mode, I do like to get that cheek like this. And then at the end of the treatment, I kind of like to do it like that. That's me personally, but it seems to be working.
Yes, you have amazing, especially when I saw your before and after photos. I think this is where I was like, okay, the work that she has been doing with all the skincare products, with the protection, but also the Lumo, this is where you're getting the benefits from, which is amazing. And I'm so happy that you're also like always keeping it realistic whenever you're doing any videos, whenever you're talking about devices. And as you answered here, it was 3 months until you were like, okay, I see the result with the Lumo. Because sometimes when you have invested in such device, it would like, okay, I want to see results as fast as possible. But no, our skin needs some time to start producing the collagen. And so I really love the realistic approach. And I love that you're not focusing only on treatment only, and a device only, but what you're doing, you're focusing also so much on the protection side, which is sun protection. That is super important. And sometimes we get the question, oh, can I do this? Can I do that? And if I would ever have the chance to talk to people that are purchasing devices, I would first ask, do you use a sun protection? Because that is the first step I would recommend for anyone who wants to prevent more signs of aging, but also help, because it also has some anti-aging benefits whenever you're doing the protection. So that would be amazing for people to start with.
Yeah, that's the first step for sure.
And one thing that I wanted to kind of explain more about the time duration of each mode. So I'm just gonna go over all modes that the Lumo offers from the first to the fifth. And the first mode, after you turn the device on, it is radio frequency. And for the radio frequency, you have an auto timer of 5 minutes. So this is 5 minutes for the face. And if you're also planning to do the neck session, you can also add another 5 more minutes. For the ion, which was the first mode that Jodylynn used for the cleansing, it has 3 minutes. So we have 5 minutes and then 3 minutes with the ion. The ENI, the product penetration, it's going to be 2 minutes. So that is a quick round of like just doing for 2 minutes. And the EMS is another 5 minutes. So while you're doing the EMS, you're also getting the benefit of radio frequency and all the other modes, except for the last one, which is the cooling, and it has a 2 minute. However, even if you're done with the 2 minutes of the cooling mode, you can keep going on because it doesn't have radio frequency. It only has blue light therapy, sonic vibration, and it cools down, and it's perfect to shrink the pores and to kind of reduce any redness if it was caused during the treatment.
Which is normal. Yeah, so yes, I do, especially on my cheek area, because I tend to get the redness here on my cheeks. And I definitely find that it helps to minimize that. But I think that also just letting people know too, like if you do experience some redness, that's normal. It really goes down like 5 minutes. I mean, it's not that long.
Yeah.
So it's not something that's going to linger and stick around by any means. Yeah. And the more that you use it, the more consistent that you are with it, the more that your skin will definitely get more used to it. So so just kind of keep that in mind.
Yeah, absolutely. And you can also like do the treatment. If you're only doing a radio frequency treatment, probably you're going to see a little bit more redness. If you're doing like whole treatments, there is going to be more redness probably caused, but it's so nice to use the cooling mode. And it's just not about the redness. It is because there's heat going through your skin. the cooling mode is going to help to kind of neutralize the heat. If there's any excess heat, this is going to help to cool it down. And it would be the same if anyone had experience going in an in-clinic treatment. You're going to get one of like those cooling creams to kind of just help soothe out. So and it is also so nice when during the summer you can just like do the treatment, the cooling mode. It just feels amazing and so.
Oh yeah, and if you're an aging woman like me that has hot flashes occasionally, that is a great treatment.
It would be amazing. Yes, I hear people saying this, that it is amazing during menopause. Like whenever you're getting those hot flashes, it's like, cooling.
Yep, it's wonderful for sure.
Yeah.
So I think that when you're done with the treatment, I think it's so important to use something that is really hydrating on the skin, like we had discussed. Now, I prefer to do my radiofrequency in the evening usually because I want all of that goodness and everything, like and that treatment, like while I'm sleeping. I want everything to be, you know, when you sleep, all of the magic is happening and healing and all of that. So I prefer, now you can definitely do this during the day, and there's, depending on my, you know, schedule, sometimes I will, but most of the time I like to do it in the evening. So then I also like to add on a really good hydrating moisturizer. And I think that that is so important. And I get a lot of questions like, is this a time that you would use your retinols or tretinoin? Can you use that during a radiofrequency treatment? And I think, and let me know your thoughts on this as well, but my kind of go-to is I think you really need to listen to your skin. If your skin is red and you know, a bit irritated, you use that cool mode, just give it a break. Like, you're not using this treatment, you should be using it every day. So it's okay to give your skin that break of that retinol or tretinoin, and I think, you know, that's fine. You can definitely go ahead and use it the next day with no problems. Anyway, you should be fine to use it the next day. But I say if you've got any irritations, just listen to your skin and don't overload it with more irritating products. Just give it some time to.
Yeah. I agree. You can definitely use a retinol after you're done with the session, but if both of those would be very powerful. So if you're doing the Lumo session, give it some time. But if you are super fine with it, you can tolerate it, you can of course do the anything vitamin A. So it would be fine. And probably you would even experience even more results because your skin is in that healing process. So you would kind of have even a more radiant and glow. But not many people feel very comfortable doing both of them. So it's, I would definitely say, and I agree, that listen to your skin. And you also like, you can do all of the modes at one session, but if it feels so much, you can do radio frequency, you can do the EMS, you can, it depends on your schedule. Sometimes you just have 5 minutes, you're going to do the radio frequency or the EMS if you have an event or something that you want to kind of have a more lifted look. But you can definitely kind of space them out. And you can do radio frequency, then use a retinol or a retin-A, depending on what you're using. And then the next day you can continue with the EMS. So it definitely offers so much, and it gives you the flexibility and the space to create your own schedule depending on your needs. And if it feels so much, skip a week. It doesn't matter in terms of like, as long as you're consistent in the long run, you don't have to overdo it, most definitely.
Yeah, that's the most important, is being consistent long term. I totally agree. And I can do my tretinoin after the treatment. I just prefer to wait. Like, I will usually do my treatment like maybe at 7 at night. And then I'll layer on my moisturizer. And then, you know, if I'm not sleeping until like a 10 or 11, then I'll add on my tretinoin on top and do that sandwich method. Yeah. And it's just, so I listen to your skin. Have skin tuition. I love that. Intuition.
Yeah, and I'm just going over the manual here, and I think it's super useful for people that are just starting out, and you can follow the guidelines also on how to glide the device, how to kind of give that lifting effect, and there's definitely details on where to use the device, where to kind of avoid or lower the intensity. Like if you're going around the eye socket, You can lower the intensity if it feels too much for you. That will be totally okay. If you're in the areas we can tolerate it more, go higher so you experience even more benefits in the long run. Yeah. Do you have any techniques or tips on how to kind of enhance the benefits of using devices and technologies? Not just about the Lumo, because I know you also use other devices. You also have the Venus. You probably use these LED face masks. There is so much that we can do to kind of benefit. But what would you recommend for people?
I think that that's such a great question. And one of the things that I think in the beginning when I was starting skincare, I always thought that more is more. Like you're going to see more benefits by, you know, doing more treatments. And when we're talking about radio frequency and really any beauty device, that's not the case. I think it's really important to use radio frequency as directed. Because you know, if you're using it way too much, like every single day, your results are not going to be what you want them to be. So it's really important to, I think, use as directed for sure, and make sure that you're not overdoing any beauty device. I really like to give my skin a day off, 100% off from beauty devices, and I'm just doing hydration. So that's usually my Sunday kind of like hydration mode, all about masks, you know, and just giving my skin a break from any type of beauty device. Because I do use beauty devices. Like I said, I'm a huge avid beauty device user. So I also like to use microcurrent and LED light therapy. So I love red light therapy, and I love microcurrent as well. And I think that is something that I've learned over the years as well is there's particular areas like the under eye area that you're not going to want and to use really intense EMS type, like really intense, because these areas tend to be already tense. And so you want to relax those areas, which is another reason why I love your Venus. So this is like that massage, like this is wonderful for the eye area, especially this area. And I don't know any other device also that you can use right here to keep this area nice and lifted. Yeah. This is lovely. And it has that beautiful vibration to help to, you know, and it's not super intense where it's contracting, because you don't want to contract this area. No. You want to have it relaxed, because we're already contracting it through tension, smiling, you know, that sort of thing. So you actually want that area to be more relaxed. Exactly. And this is wonderful.
You can do this every day. It's totally okay.
Yes. And I also love this. I found that it's multifunctional. Not to only can you use it here, but to also use it around the lip area for those fine lines that we can get here as we age. Yeah. This is a lovely for that. And also you can get a nice little plumping effect if you are using that sonic vibration with some hyaluronic acid. I love that. I love it. And if you're using some of that, like just even the ordinary hyaluronic acid, put some of that on there and just use that on here, that blue mode, and get that vibration going, and you will see just a nice plumpness. That's just beautiful.
I love doing this on my lips, too. And it also has heating. So it's not going to cool down, such as the Lumo has the cooling mode. It's going to have the heating effect, blue and red light therapy. So you're getting both of this, which is going to help also with, if you're using this with an eye cream, it's going to help to push products deeper. So you're going to get the benefits. But it's so nice with the sonic vibration. It's just like your eyes is going to feel so relaxed. And you can use it with or without. Sometimes when I'm doing the Venus, if I keep the vibration on for the whole session, I kind of feel like it's tingling for my eyes, and I just need to kind of relax for a bit and just do the treatment without the vibration. But it's so
Yep.
nice to just like relax and use it, and it's super easy. Like you don't have to do much. You just flick the device, you change the color. It's amazing.
Right. That's really cool too. That was very innovative on how you guys did that.
Yeah.
Where you can just quickly and it changes. That is so cool. And I love that you can put your finger right on the silver part and it will automatically turn on the vibration. And once you move away, it will turn it off. That was genius, by the way. I think that's so genius. And another thing is that, and I think that this isn't discussed a lot, but I feel that, so this is a very gentle treatment for the under eye area. However, it's effective. There are devices that are so hot or so intense. And I feel like for this particular area, we need to be, especially at home, we need to be super gentle and we need to hydrate, hydrate, hydrate. And I feel like this is that treatment, which is why I love it. I mean, yeah. So just, you know, and it's the same with even the face. Like when we're talking about like the Lumo, and while it has that RF and it's got those 5 levels of intensity, it's still gentle enough on the face that I feel like it's like giving you, it's like I'm giving my skin some love rather than so intense and so where you need all of this downtime. That, I mean, that can be obviously good depending on what it is that you're looking for sure, if you go in treatment. But if you're looking for something more gentle, I've just found over the years, like I said, 3 years, like treating the skin with love and, you know, really giving it time to heal and using the devices as directed has made such a difference. So, I don't know, that's just me.
Well, thank you so much for sharing this, because I 100% agree with this. And it's super nice that at-home devices are designed very powerful, so you get the benefits, but it's not too powerful that it's actually causing too much redness or too much damage, that you actually need a very long cooling or downtime period. And and when you talk about the Venus, it is super nice because you can also use this in the eyelids. And if you're talking, when you mentioned that the devices sometimes they tend to get too hot, that is actually a negative or a side effect, because your eyes are going to dry too much, and we don't want to cause anything lower than the skin area. So we don't want to cause anything such as dryness. This is why we also had to design another device that it's not the Lumo to be used on the eye area. It has to be a little bit gentler, because Lumo is way more powerful compared to what the Venus can offer. And this is why it also uses thermal heating. So there is so much research done, and I just love kind of getting deeper into like reading the studies and learn more about technologies and the benefits that those offer, because it's amazing. Like, you're doing this at home, you're getting the glow and the benefits and the youthful kind of look, and compared to going to an in-clinic treatment, that is just way cheaper. It is an investment, but it's way cheaper.
Right, exactly. And this is definitely, well, I've also heard a lot of people, like if you decide to go that route, like if you decide to get Botox or fillers or going in clinic treatment, beauty devices can definitely help to prolong, so you're not going in so often. And so you're going to save money. And everyone has like that different look that we're looking for, right? So like if you think about the body, you know, some people just want to lose 10 pounds. Some people want a little bit more of a toned look. Some people want to become a bodybuilder. So it all depends on what you're doing, you know, and what you're eating and how you're working out. It's kind of the same with the face. You know, some people just want, you know, are okay with this and aren't okay with that. Somebody want a really taut look. And I think that I love that we have all of those choices and, you know, possibilities. And I think that what has been missing in the skincare industry up until the last few years is what we can do at home. And that has finally come, which I love, you know, to be able to get those anti-aging treatments without having to go in, if that is something that you want to do, or if you decide to go that route, again, you can use these to maintain results.
Absolutely.
I think it's Angie from Hot and Flashy. I think that she is actually only going in once a year now, because she's gotten her like for Botox, because she's gotten her face, you know, with a great skincare routine. She uses beauty devices, and I think that she said that she's only going in once a year rather than every 3 months like she used to. And so I think that you know, something to keep in mind if you do decide to go that route.
Yeah.
But you don't have to either.
Yeah, if you feel like doing a Botox or having another treatment, it is super fine, and you can use a Lumo if you have the Botox. We will recommend giving 2 weeks for everything to kind of settle in, but otherwise you can maintain the results with such device. And what we're doing with Botox, we're kind of numbing our muscles. So what we're doing with the Lumo, we're kind of training them to stay that way. So I think it would still be a suitable treatment to maintain the look, but it makes sense if you have more signs of aging and you want to still go into a treatment once per year. Sounds amazing. And then you have the whole skincare routine, and you have a protocol on how you use devices. It's amazing. And as long as we're not overdoing devices, because this is also something that it is nice that those devices are accessible, but especially with the Lumo, we recommend having a more limited time on how you use. It's going to be 25 minutes for the whole week, also depending on the age group and how you kind of have the protocol. So you kind of need to figure it out how it fits into your schedule. But it would be the same as going to the gym. If you're going to do weightlifting all week long, you're gonna feel some muscle numbness. So if you're doing the EMS in this case every day, you're gonna feel your muscles a bit numb. So that's not gonna be the positive effect. So this is why there is a schedule. This is why there is a protocol that you need to follow. And this is why I'm super happy that you're here and sharing YouTube content. You're also creating amazing content and sharing stories on your Instagram as well. So I would really recommend for anyone in this journey, please check her content, because you're going to be able to learn so much more than what we're talking about the Lumo here. And yeah, it's very nice that you also are educating people on how to use devices and skincare.
Well, that's really important to me too, because I want to make sure that they are getting, if you're if you're going to invest in a beauty device, you need to know how to make it work for you. And I want you to see results. So, so using it correctly is so important. So, yeah.
100%. Yeah, well, amazing. If anyone has more questions, I just want to let everyone know that I'm going to repost this live. So both of us, we could share on our feed. So if you have more questions, please feel free to drop them here. We can answer them later on. Feel free to reach EvenSkyn, feel free to reach Jodylynn directly if you have questions, but she has tons of videos already talking about so many different things. But I really want to thank you so much for doing this sessions with us. It's a live Lumo treatment, and it was super educational. So I'm so glad that we had this call.
Thank you so much. I appreciate it. And thank you for having me. I love being on here with you.
Me too. And we can talk about skincare and devices all day long, but I'm really gonna let you go, and thank you so much. Yes. I wish everyone a good weekend, and yeah, thank you everyone for joining.
Thank you so much for joining.
Yeah, bye everyone.
Bye.